I'm Dr. Natalie Marks, and here's another quick cup of knowledge for you. Joining me today is Dr. Daniel Fletcher. He's a boarded criticalist and associate professor at Cornell University, College of Veterinary Medicine. Thanks so much for joining us.
Thanks for inviting me.
Well, we're really excited to have you here because you are one of the founders of the Recover Initiative, publishing one of the first, I think the first, guidelines on CPR in veterinary medicine. I'd really love to find out, how did that come to be?
Sure. So back in 2010, I was interested in trying to develop some standardized CPR training materials, and I approached a former resident mate of mine, Manu Bowler, who's on the faculty now at the University of Melbourne. He was doing CPR research at the time in a human medical lab, and so I asked him if he would be interested in collaborating on that, and he said yes, he would love to collaborate on that, but he had no idea how to do CPR in dogs and cats because no one had actually ever looked at the literature and tried to come up with a plan for what's the best way to do it. So that sort of launched this whole initiative. We had some initial discussions about how we'd want to do that. He is very well connected in the human resuscitation community, and so he reached out to some of his colleagues and we talked to them to try to learn how they write the human CPR guidelines, and really we modeled our approach completely on how they do it. So that's the International Liaison Committee on Resuscitation. That's the group who puts together the human guidelines every 5 years, and they were extremely generous and helpful in their interactions with us and provided us with a lot of ideas about how to do this. And so we put out a call to try to find some people to help us, and wound up recruiting over 100 board certified veterinary specialists to do an evidence evaluation, to actually answer a series of questions about CPR in veterinary medicine and to read the primary literature and actually try to answer those questions. So took us about a year and a half, and we got it done and published those guidelines in 2012.
That's wonderful. So for practitioners like myself who learned CPR way back in school, what are some salient points here that make Recover different?
Yeah, I think one of the things that we're really excited about is this opportunity to offer standardized training that's evidence-based. In human medicine, all health professionals are required to be CPR certified, so they stay up to date on the current guidelines. As you said, most veterinarians and most veterinary technicians learn about CPR when they're in school, and then there's no standardized training, and so what they learn then is where it stays. And it turns out that our knowledge about how to do CPR has changed dramatically over the years. Luckily for us as veterinarians, the major experimental animal that was used to develop a lot of the early CPR data were dogs, and so we could sort of directly apply that. And I think a great example of why it's so important to stay up to date is back when I was in vet school, the thought was to do CPR, to do chest compressions at a rate of 60 to 80 compressions per minute. We now know that if we do it at that rate, we're very unlikely to get a return of spontaneous circulation, that we actually have to go much faster at about 100 to 120. And when we ask that question to people, even board certified veterinary specialists, we find that a lot of people are still using those old approaches. They're still doing it at 60 to 80, and we know very definitively from the evidence that that's not the right way to do it. So I think this opportunity to really look at the literature, really figure out what the best way to do CPR is, and then to provide the training that's in a very standardized way, I think is the way that we can really move this into a different direction for veterinary medicine.
You know, I think what's really exciting for me about this is that for a general practitioner, CPR can get very frustrating, right? Because we don't get a ton of success all the time. And it's also something that takes a really team-based approach. And I'm assuming that's part of what you discussed in the initiative.
Yeah, it is. It's interesting that you make that comment because I also find CPR very frustrating because I work in a tertiary referral facility. So I do CPR on a lot of patients who I would argue didn't arrest. I actually do CPR on a lot of patients who died. So a cardiopulmonary arrest is reversible. Death is not. Death is irreversible. So I get lots of opportunity to practice it, but I don't get to do it on patients that have a good chance, whereas people like you who are in practice actually probably have a much better chance of success than I do, because you're dealing with acute reversible problems. You're dealing with those horrible situations where a perfectly healthy animal goes under anesthesia and unfortunately arrests because of a weird reaction to a drug or something like that. Those are the patients that we have a really good chance of getting back. And actually, if you look at the data we have, about 50% of dogs and cats who arrest in the peri-anesthetic period can survive to discharge if we do CPR right away. So that means those cases that general practitioners are anesthetizing every single day, if they know how to do CPR, they're looking for it, they're monitoring closely, and they act quickly, there's every reason to think that they could have great success rates. So for them, it should be a whole lot less frustrating than for me. It's just sort of understanding how to do it and being confident and comfortable enough to do it. And that's what we're trying to accomplish with the training we're doing.
And for people that are watching this that are really interested and obviously very excited about these new opportunities, where can they learn Recover?
Yeah, so we've put together, I think, a really nice package of standardized training. The place to start is our website. It's recoverinitiative.org, all one word. There's an online course that you can take. It's about 8.5 hours of contact time, and it's RACE certified. At the end of that, the rescuer is now certified in online CPR. And then after that's done, there's an opportunity to actually come into the lab and do hands-on training. And so we've been working over the last few years to train veterinarians and veterinary technicians who are passionate about this to do a standardized in-person training. So they get to actually practice the hand skills, they work on mannequins and simulators, and they really get to apply what they've learned in the online course, and then ultimately they do an assessment, and once they pass that assessment, they're official certified rescuers in CPR.
And you mentioned simulators. I'm really intrigued by this. I'd love for you to tell us a little bit more about your lab, the Tetlow and Roy Park Innovation Lab that you created, it looks like in the fall of 2015.
Yeah, I would love to. It's definitely one of my passions. So back in 2009, I went to the Society for Critical Care Medicine meeting, a humans meeting, and that was the first time I ever learned about human patient simulators, which are used extensively in human medical and nursing training. And I just saw this thing and I thought, this is just amazing, because I have had the experience as an educator in a veterinary school that students will come to my classes, they'll give me great reviews on my lectures, I teach them about shock, I see them in the hallway, I say, what are you going to do if this patient comes into you in shock, he's tachycardic, he's got pale mucous membranes, what's your plan? They can rattle off exactly what they want to do. And then in the fourth year of the curriculum, they show up in the clinic and I have this exact case in front of them. I say, okay, what do you want to do? And they panic. They turn into complete deer in the headlights and back away. And so I was really intrigued by this idea that you could teach them the didactic knowledge, but then bring them into a lab and let them practice it in real time where they take control of the situation. I don't have to be the one making the decisions, and they can actually practice and see what they can learn by applying what they've learned in class. And it's just such a powerful way to teach and sort of acts as a great bridge between preclinical and clinical training. So I came back from that meeting very fired up and decided I really wanted to do that. I wanted to build simulators for veterinary medicine. So we did an initial project with some initial funding from Cornell, and we bought a human patient simulator. We took it apart, we stuck the pieces into a dog mannequin, and we used that simulator for about 6 years, and it was a very, very effective way to teach. Had some really good capabilities, but was really expensive. So we were spending $27,000 on a human patient simulator that we then cut into pieces and shoved the pieces into a dog mannequin, which was not a viable long-term solution, and we were very limited in being able to modify it and things like that. So for years I really wanted to try to develop our own, and luckily enough about a year and a half ago I was able to secure funding through the USDA and through the State University of New York to actually develop our own simulator platform. So I was able to hire some programmers to work with me, and we've developed an open source platform, so software that drives the simulator, and you can actually just use the software by itself to simulate scenarios, and then a design process or a design for an actual simulator that uses almost exclusively off-the-shelf parts that you can order off of Amazon if you want to, and you can build your own simulator. So the hope is now that we've got this platform established that people will engage in that, they'll start to use it, they'll add to it, add functionality to it, share that back to the community, and develop scenarios for it so we can use this training more widely. And this is the platform that we're now using for our CPR training as well.
Wow. I'm blown away by that, and it certainly seems like there's endless possibilities for those simulators to help with students and also practicing veterinarian technicians in the future in lots of disease states.
Yeah, absolutely.
So, well, thank you for all you've done, for what you're contributing to the profession and your mentorship, and you're very much an inspiration.
Oh,
Thanks for joining us, and have a good rest of the conference.
Thanks for inviting me. I really appreciate it.
Absolutely.